Having kids of my own made me realise what a privilege it is to spend time with children. They make great patients, they heal quickly, keep cheerful, and they want to get back to being kids as quickly as possible, says Dr Gavin Spence, consultant paediatric orthopaedic surgeon at Burjeel Hospital for Advanced Surgery. Tell us how you became a children's orthopaedic surgeon.
So I trained as an orthopaedic surgeon in general, and part of that included training in paediatrics, and it rapidly became apparent to me that that was the specialty I wanted to do.
Nice. How is children's orthopaedics different to adults?
So I think it's important to say it's a completely different specialty. We use very different techniques in children's surgery to our adult colleagues. So all adults generally are pretty capable at answering questions, and there's a set way of examining them. But for us, we have to tailor that a little bit. So if you want to take a history from a 4-year-old and examine them, you're going to have to work a little bit to engage them, because your average 4-year-old is not very keen on being examined. So to win the trust, it's a completely different approach.
Can you give us an example of what parents should look out for?
So I think there is a huge number of conditions that children can present with, but here are my 3 top tips for parents, if you like. So new parents, really important to make sure that your child is properly checked for hip dislocation. All children are screened for this, but it's very important to identify that problem early. I would point out to parents to take elbow injuries very seriously. The reason is elbow injuries are common, and often the severity of them is not fully appreciated, and sometimes not even appreciated by the treating doctors. Final point is related to teenagers, and this is very specific. So many teenagers will present with problems with pain around the hip region, but sometimes it can be a little lower in the thigh and the knee, and it's rather insidious, and the assumption is that this is a groin strain. There's a very important condition called slipped epiphysis, which again is really important not to miss.
So on those lines, how do you manage worried parents or parents with anxiety?
Yeah, so that's a really common problem, there's a few ways of dealing with it. In my experience, most parents are reassured once they see that you are engaging with their kid and that you are taking their concerns seriously. So a good part of it is making sure that you've got your ears open and you spend a bit of time really truly listening to not just what you think the medical problems are, but what their individual concerns are.
What makes Burjeel Hospital for Advanced Surgery unique?
Obviously, it's important for us to be up to date and to be bringing the latest technology, the latest techniques, the latest way of dealing with children's orthopaedic problems. But increasingly, I'm appreciating as the years go by that, important though that is not the most important element. The most important element is experience. If you have built up a period of experience, both with dealing with kids and dealing with kids' surgery, you have a good library of techniques to draw on. And good surgery actually is as much about the preparation that you put in as the skills and the techniques. Those cannot substitute for experience and good preparation. And the final element really is the teamwork element. So I think maybe last century the idea was that a surgeon ran their own service. We've kind of moved on from that now. Surgery is one element, but the treatment as a whole, the quality, comes from being treated by a team, and that's what we're aiming to build here at Burjeel.